Hi, I'm Jeff Holloway, and I'm a pediatric sports medicine doctor here at Prisma Health, and I'm the director of the Concussion Clinic. And today is National Concussion Awareness Day, and so we wanted to provide you a little bit of information about concussions, from how to kind of think about them, how we diagnose them, how we treat them, and some general rules behind them. A concussion is a complex issue because it's dealing with your brain, but it's basically any mild traumatic brain injury that you sustain because of an injury that causes force to the brain that then produces chemical reaction, chemical processes that produces a lot of symptoms. So unlike some of the other traumatic brain injuries, which are a little bit more life-threatening, concussions are not that, but can be serious, producing a lot of symptoms. Those things include headaches, dizziness, not feeling right, very much fatigued. Unfortunately, everyone's symptoms can be a little bit different, so some people can be much more sad, some people can have much more of those symptoms. Luckily, most of the time that does tend to go away over a few weeks. Some of the red flags we look at to decide whether or not you need to seek urgent medical care would be things like extreme issues. Those would require ER visits, urgent care after this injury. Concussions themselves, we want to watch and see how they heal over time. That includes seeing doctors that do a number of tests. These tests are some objective findings that allow us not only to rely on your symptoms and trying to figure out how your brain is working, but look into some of the nuances that have. Here at the Concussion Clinic, we do some of those testings. We're starting to provide baseline testing so we can compare you to yourself and know if things are recovering, again, in that 2 to 3 week period. But unfortunately for some people, these symptoms linger and last a long time. So we try to follow that over time and help prevent these problems by relative rest, increasing back to our activities slowly, at school, avoiding re-injury, sports, those sort of things. Some other important things that are helpful is ways to prevent that. So during sports, wearing proper equipment. While no equipment will prevent concussions and keep them from ever happening, wearing the proper size helmet, tightening it correctly is very important. But ultimately, one of the biggest things that you can do during sports is being aware of concussions. So if your child or you sustain a concussion while playing, you're able to sit out and avoid further injury. So we kind of adopt the mantra of when in doubt, sit them out, and that avoids some of the major complications that we see of repetitive injury and really making things worse. That is what we think is one of the biggest things with concussions, and if you have further questions, further comments, feel free to check out our website. Feel free to call us at the Concussion Clinic, and we can help answer you those. Also feel free to leave comments down below, and we'll try to follow up on you on those and provide any more information about concussions. And thank you for watching.